competitive session.
Good afternoon. My topic is retinal examination and imaging in predicting maternal and neonatal outcomes in patients with gestational hypertension. So, hypertensive disorders of pregnancy continue to be a major contributor to maternal morbidity, perinatal compromise, and long term cardiovascular risk. And the risk stratification and prediction of pregnancy outcomes remain a difficult clinical challenge. Why retina is important? It is the only site where microvascular changes can be visualized directly. And the retinal microvasculature acts as accessible surrogate of uteroplacental circulation as it shows shared mechanism of autoregulation. And optical coherence tomography offers a non-invasive, rapid, objective imaging modality that can be safely performed in pregnancy. So my aim was to identify and explore the role of retinal examination and imaging in predicting maternal and neonatal outcomes in patients with gestational hypertension. Now, the methodology, the design, it was a prospective cohort study done from March 2024 to August 2025 over a period of 18 months and included pregnant women in whom hypertension was diagnosed after 20 weeks of pregnancy, attending our OPD in tertiary hospital, and were between the age group of 18 and 45 years. Sample size was calculated and found to be 43 with consecutive sampling until sample size was achieved. And exclusion criteria were of patients with pre-existing ocular or systemic disorders affecting the retina, patients on retinotoxic medications, and patients having media opacities interfering with fundus examination and good quality OCT image capture. The study procedure, it was done twice, once at 20 weeks, where history, visual acuity, anterior segment, and fundus examination were done. Clinical hypertensive retinopathy was graded, and OCT imaging and fundus pictures were captured. And at the time of confinement, maternal outcomes and neonatal outcomes were assessed. Now, the data analysis was entered into the Excel worksheet and performed using SPS 23 software, and the association between retinal examination and imaging findings with maternal and neonatal outcomes was done using Fisher's exact test, and p-value less than 0.05 was considered significant. And odds ratio for predictive performance were also calculated. Coming to the results, majority of the patients were below 25 years and were primary gravidae, and all 43 patients had good visual health and exhibited IOP values within the normal physiological range. Now, grade 1 hypertensive retinopathy was detected in 7 patients by using Keith Wagner and Barker classification. And generalized arteriolar narrowing was the commonest finding seen, with additional cases of serous macular detachment with PED, serous retinal detachment, and ILM folds in 2.3% each. Now, coming to the OCT, the mean central macular thickness was within normal physiological range. And OCT parameters showed serous macular detachment with PED, extrafoveal subretinal fluid, and ILM wrinkling. Now, this was the spectrum of diagnosis where we had 7 patients with hypertensive retinopathy, and each case is 1 case of hypertensive retinopathy with central serous chorioretinopathy and 1 case with posterior reversible encephalopathy syndrome. And these are the fundus images and the OCT images of the same. Now, coming to the outcomes, the maternal outcomes, cesarean section was done in 8 patients, and adverse maternal events included ICU admission, postpartum hemorrhage, placental abruption, and posterior reversible encephalopathy syndrome. The neonatal outcomes included preterm birth, low birth weight, low Apgar score, and NICU admissions, but no neonatal deaths were reported. Now, coming to the associations, abnormal findings on retinal examination were significantly associated with cesarean delivery, ICU admission with high odds ratio of 102, and postpartum hemorrhage. Placental abruption and press occurred only in women with retinal abnormalities. Coming to neonatal outcomes, preterm birth and low birth weight and low Apgar score and NICU admission occurred predominantly in infants of mothers with retinal abnormalities with high odds ratio of 87.5 for preterm and low birth weight. And between OCT findings, we had positive OCT findings with poor maternal and neonatal outcomes. Now, there was a correlation study between the retinal manifestation and OCT and showed that there was 100% sensitivity, 90% specificity with positive predictive value of 42.9 and negative predictive value of 100% for detecting clinically discernible fundus abnormalities, indicating strong concordance and confirming that a normal OCT reliably excluded macular disease. Now, this is the comparison of prevalence of changes, and the close concordance between retinal and OCT findings and earlier literature reflected the strong reproducibility of ocular biomarkers across hypertensive pregnancy studies. And coming to the outcomes, it reaffirms predictable risk pattern consistently observed in hypertensive pregnancies. And even though we had one single episode of posterior reversible encephalopathy syndrome, it matches with international figures, reminding that while it is rare, it remains a critical complication to watch for. So the conclusion is retinal examination is a sensitive, accessible, and cost-effective predictor of future maternal risk, and even early hypertensive retinopathy can show statistically significant associations. Emerging fundus examination is excellent screening tool for functional abnormalities, while OCT adds value to useful adjunct. Now, retinal examination should be integrated to routine antenatal evaluation, where the response settings where Doppler facilities are limited, and OCT is desirable adjunct, and large multi-central studies are also recommended to validate these findings. Thank you. Yes, sir. Sir. Sir, so we actually did, the sample size was 43 patients, and out of that, 7 patients had this hypertensive retinopathy changes. And out of that 7 patients, 6 patients had poor maternal and neonatal outcomes. That is, out of the 6 patients, they had cesarean section, they had a postpartum hemorrhage, and ICU admission was mandated. Out of the 8 patients, 6 months, and single episodes of placental abruption and posterior reversible encephalopathy syndrome also. Yes, sir. So the thing is, in the other normal group, actually out of that normal people, they had normal delivery, they had no other complications, and only 2 patients out of the 35 samples had cesarean section, and that too was, one had a preterm because of leaking, and another one had failure to progress, and the neonatal was. They had gestational hypertension, sir, but hypertensive retinopathy changes were not noted in their eyes. And their outcomes was found to be good when compared to the patients who had hypertensive retinopathy changes. Yes, sir. Yes, sir. Actually, the BP. So the BP was actually 114, 90, 150, 90 for most of the patients. The BP was same for the patients with retinopathy changes and without the retinopathy changes. But the ones with retinopathy changes, we found out that the outcomes were poor compared to the normal group.
It looks like an observational study. And did you look, I mean, those patients who worsened, did you look at the renal parameters?
Yes, ma'am. The renal parameters were normal for them.
The renal parameters are normal,
Yes,
BP
ma'am.
was relatively controlled, but those who had retinopathy had relatively bad outcome. That's
Yes,
what
ma'am.
you're saying.
Yes, ma'am.
So according to you, if a patient needed cesarean section, that was an adverse outcome?
No, madam. Actually, the for most of the patients, there were Doppler study was also done subsequently, and there were poor uteroplacental flow for the patients, and some patients had IUGR, and they had to terminate by 34 weeks and all.
There were other indications for cesarean, right? Not just because these findings were there.
Ma'am, the thing was, we found that all the patients actually, we did Doppler study, and Doppler study was positive only for 2 patients.
Renal Doppler, you mean?
Ultrasound Doppler, ma'am, uteroplacental circulation Doppler. So actually, we did a subsequent study and found that retinal manifestations had much more chance in predicting compared to the Doppler ones.